Hey everybody, it's Jenny Abbots. I wanted to do a quick recording of updates. I am actually on PTO the week of MLK for a family emergency, and didn't want to wait to get some of these COVID updates out to you. And unfortunately, during the task force call this past Friday, we just didn't have enough time. So hopefully this method of delivery will work for everybody. If you have questions after this update, feel free to reach out to the COVID-19 email address. It's covid19@ncchca.org. So briefly, just a few notes under the testing umbrella. So LD3 stands for liquidated damages 3. So that is in reference to the demographic penalties that are assessed from the state for those participating in the OP9 contract. Wanted to let you know that as we start to get payment in from DHHS, that there is a likelihood that those numbers might be a little bit lower than what some of you are expecting to see. I'm not sure of the exact date, but at some point this summer or fall, I believe it was maybe more closer to fall timeframe, DHHS made a decision that they were no longer going to accept a response of did not answer, or the patient marked that they did not know when it comes to their primary language spoken. So in the past, they gave credit for that. As long as that answer was selected, it wasn't a penalty. And then they had determined that they were going to assess penalties, that was no longer an option. And then we have since then also heard that there might be some changes coming where they're not going to consider that any longer. So we have not seen that in writing. So at the moment, just keep in mind that if you start to see reimbursement come in and it's a little bit lower than you expected, it's likely due to that LD3. You're always welcome to reach out if you have questions and want to confirm. And we will be sure to update you once we have confirmation on if they are going to do away with that primary language penalty after all, and when that becomes effective. The next thing worth noting under the OP9 contract is that invoices have been submitted through the end of October. We were ready to submit November and December data, and then one of the health centers sent in their OP9 information later. So Rob had to pause preparing that invoice, go in and validate the information, and it has caused a delay. So I just want you to try, I know you guys have got so much going on, but try and get those events in a timely manner so that we can go through our back and forth with DHHS to validate the information before we get it submitted for final approval. It's quite the process. So the sooner we can have your information, the sooner you can get paid. And then it's worth noting that the state is starting to receive rapid tests. There was a period where they didn't have any available at no cost. They are starting to get a supply in. However, they are prioritizing those to schools. I say that, but I do know of 2 events this past week where our health centers were able to get some of their supply due to various testing needs in their community. So if there's something that you feel is a standout circumstance that would justify you needing to get those rapid tests, let me know and I can work with the state to see if we can get you in that priority group as a one-off until they start to get replenishment of their supply. But just want you to know that that's what's happening on the testing front. And then for those of you who are participating in the HRSA testing program for the at-home test kits, so as a reminder, these are the test kits that HRSA will supply to you, and the idea being that you guys then hand them out to members of your community. They are the at-home test. It doesn't require the health centers to do any of the testing process. We know this might be a challenge for some of the population, but it is an option there. Really encourage you guys to participate in that program. When we look at all of the states, North Carolina is ranked 30th out of the 50 states and territories that are participating. So we definitely want more health center participation in that program. That said, we do know that delivery of those tests has been a bit delayed. That's been due to the manufacturers just trying to catch up with the demand. We're starting to see those going out. So we're hopeful that that delay should start to minimize and soon not even be an issue. If you have questions about how you can participate in that program, feel free to reach out. If you're already involved in VPOP, so the vaccine online portal for HRSA, you can go through that and access information there. I think it's under diagnostics, it's DPOP. And that is, you can go in there to get information on how to register for that program. Otherwise, reach out to the COVID-19 at NCCHCA.org if you want some help in that. So shifting gears a bit to vaccines, as you know, recently there were many updates on boosters. So if you have any confusion as to who's eligible these days and what the time frame is it 6 months or 5 months? It's 5. You feel free to go to our website. There's some links there on the COVID vaccine page that will take you direct to the CDC that has a nice grid with that information. And that information was also emailed out to you guys, but it is being updated on our website with, again, links to the CDC so you can get direct to the source. And just to note that North Carolina has 23.2% of our pediatric patients that are vaccinated, which is great news. In the Medicaid region, Region 4, we are the highest ranking state. So I think the second ranking state has like 17% of their population. So kudos to you guys, good work, keep up the hard work. There's still lots of room for growth there, but you guys are knocking it out of the park. And then just to note that North Carolina is now 70% fully vaccinated, and I think 74% with at least 1 dose. So we're getting there, and that's all a huge thanks to everybody who's had assistance in making that happen. And then along the lines of therapeutics, I'm not going to go into this. Her DHHS rather did a presentation last week to our pharmacy directors, and then a very brief presentation to the CEOs on the task force call this past Friday. Basically, there are 2 oral therapeutics that are available to health centers. If you're interested, reach out to us at that COVID-19 email address or check in with your pharmacy directors. The slides and recording were sent out if they weren't able to be on that call. But definitely would encourage you guys to participate in that. It's worth noting the state has a program, and HRSA has a pilot program where they invited 200 health centers across the US to participate in the therapeutics program. So I think that's maybe ended up being 4 North Carolina health centers in that program. The only difference between the state and the HRSA program is that HRSA is prioritizing health centers, whereas the state has a little bit of a different algorithm. I will say the supply is very limited. I think the example that the pharmacist Tim with DHHS gave is that when we look at the available therapeutics, it comes out to about 7,000 doses a week that are available across the state. And we're seeing about 23,000 new COVID cases a day. So a little bit of a mismatch in supply and demand, but nonetheless, it is something out there that you can toss your hat in the game if you'd like. So that is about it for the updates. As always, we're here for you guys if you have questions. I do want to also note that along with this recording, we're going to send out a link to a quick survey, 2-question survey, super easy. One question is a follow-up to a question we asked during the task force call, where we were checking in on who's having difficulty getting supplies. We had 16 health centers respond, and the majority of people were having a hard time getting items like masks and PCR and rapid tests, even those that they're paying for. Obviously, those at no cost are kind of pretty much scarce. But if you're having challenges, Brandon Washington and I met earlier this past week with another vendor where we might have some opportunity to find another supplier, just add them to the other suppliers that are currently in the mix. So we need, in order to pursue that, we need to know if you're interested, if you would be willing to order from somebody else, if maybe Henry Schein, for example, can't get you what you need, and what your anticipated volume would be. The other question that I want to find out from you guys is, Leslie and I have been talking about how to put together some sort of way for you guys to communicate amongst yourselves. So just wondering if the best manner is through a Slack program, kind of like a instant messaging type program that all health centers can use without being on the same platform within their organization, or would an email approach be better and you could opt out of either program so you don't inundate your inbox? But the idea behind this is, like, I had a health center the other day who was asking for performance data, or I'm sorry, was asking for job descriptions for a particular role related to COVID, or somebody else who was asking about some quality measure related information. So these would be a great way to utilize this suspected proposed communication method. Just want to see if you guys would find that helpful. So that's it. Sorry, couldn't do this in person. Again, I'll be on PTO the week of the 17th. So I'll be returning the following week. Any questions, feel free to use that COVID-19 email address. Thanks so much. I hope you have a great week.